Discovery Health Channel. Real stories of human triumph. The leading edge in high-tech medicine, fitness, and information you can trust for a healthier life. Discovery Health Channel, a new 24-hour TV channel and website devoted to what's most important, your health. Discovery Health Channel and online at discovery.com/health.
It was once thought that the very young don't feel pain. Whether infants or teenagers, kids do hurt. But as patients, they are different from adults. Caring for the completely dependent and the fiercely independent. This is the challenge for pediatric nurses. The Children's Center at Johns Hopkins Hospital in Baltimore, Maryland. Here, new nurses like Charlie Wheeler learn the ropes.
It's supposed to be, a job. You go in there and you're supposed to be able to separate your job from your outside life. But it's not that way for me. I take things like personal.
Experienced nurses like Natalie Lundy appreciate even small rewards.
Some children touch you in a way that you didn't expect. You get a bit of a hard shell. Not to say that you don't care. In fact, you care immensely when you're there at the bedside and you're with the family.
And the challenge of caring for children is what drives nurses like Pam Butler.
It always amazes me when I go to a party with my husband and they ask you what you do. And they always look at me like they feel sorry for me. That must be so hard. Well, no. This isn't hard. This is one of the joys of my life.
The Pediatric Intensive Care Unit, or PICU, is for the hospital's most critically ill children. Natalie Lundy has been a nurse here for 7 years.
When you come in, you can sort of tell that it's going to be a busy shift, like the trauma phone's ringing off the hook, and there's ORs rolling back as you're coming in the door. There's a lot of teamwork in the PICU. We never let each other drown, so to speak.
Clear rates in the 40s, 50s, easy, non-labored.
We're always, helping each other, educating each other, emotionally supporting each other.
As the nurse in charge today, Natalie has her hand in everything. Nurse Irma Zerb needs help changing an IV on a boy having seizures. An infant who just came back from open heart surgery needs medication, sedation, and respiratory support. And down the hall, there's a little boy who was electrocuted. Isaiah Moore has second and third degree burns on 25% of his body, and his right hand has been amputated. He is being prepped for his second skin graft surgery. Butch Grebos is Isaiah's grandfather.
And he's going to have to deal with the trauma of not having an arm, you understand? But I know he's strong, and he don't give up nothing. He don't give up. He's a fighter. He's a fighter.
The intensity of the PICU leaves little time to rest.
So this is lunch. This is the first and last time I will be eating today.
Charlie Wheeler has only been a nurse for about a month. Before nursing school, he was a medic in the Army.
In the military, you can be deployed anywhere in the world, or you spend like 3 out of 4 weeks a month out in the field. So at least this way I get to see my family at night. They might be sleeping, but at least I get to see them.
The scope of knowledge and skills a pediatric nurse must have is often overlooked.
Stereotypes of nurses, you know, the doctors order you around in your white butts. Yeah, we wipe butts, but it's not our only job. Especially in the PICU, we're in with the patient 24/7, at the bedside at all times. And if we don't think a patient's looking right or a patient needs something, you can make the suggestions. The doctors are very receptive.
Isaiah Moore's surgery is about to begin. He's been lucky so far. His grandfather saved his life.
I'm sitting around on the front, and a little boy come around. Mr. Butch, I said, what? Isaiah's laying in the alley with a wire in his hand, and I'm scared. I jumped right up, and I ran around there, and I seen him. He had the wire in his little hand right here, but all this was burnt completely black.
In there, we'll see if we may have to take some skin grafts.
I went over there, and he wasn't breathing. I kept doing this to his heart, you understand? And then maybe about, I say about 30 seconds, he took like a deep breath, and then he opened his eye, and then he went back to sleep.
His scalp looks pretty viable here, Pierre, so I think we'll just...
Things can happen like a split second, you understand? You're looking at him, you go outside, and then all of a sudden, 2 minutes later, the children come around, Isaiah's laying in the alley with a wire in his hand. That's how quick things can happen.
After more than 3 hours in the OR, Isaiah is back in intensive care. His mother, Vicki Mitchell, will stay by his side.
All right, come on, let's get a new diaper. The one you got on is disgusting.
Downstairs from the PICU is the infant unit. Here, the children are not quite as sick.
When I was just a wee little boy.
On a given day, Pam Butler has up to 4 babies to keep her busy. But after 20 years as a nurse, she knows some tricks that help her patients cope. Like having a special room where the painful procedures are done.
Then they don't have to worry about when they're in bed that somebody's going to come in and do something mean to them. We try to do all the mean stuff in here. That's the goal. Oh, she knows this room. Yeah, she got hated. All right. We'll do it right up here. I won't put you down. Okay. For a child, everything has to fit. So if I go in and I'm very serious and I'm a nurse and then I'm a scary person. All right, so my goal for the day is to make you smile, huh? But if I act goofy and I'm singing bibbidi bobbidi boo before I ever touch them, then all of a sudden I'm not such a scary person. And I'd really like for them not to be afraid of me. Yeah, your mommy's here. She just went down to get something to eat.
Another of Pam's patients today is Ricky Lane, who has been complaining of headaches.
All I want to do is take your temperature. Okay? I'm not going to... He's a kid who's born with achondroplasia, which is a form of dwarfism, and they have, as part of their syndrome, a likelihood of having hydrocephalus. Can I take your temperature?
Yeah, but I want my mommy.
Ricky, I promise she didn't leave.
Hydrocephalus is excess fluid around the brain. Ricky has a shunt in his head to help drain the fluid.
Yeah.
Okay. And this is it.
The doctors are concerned that his headaches may be due to a blockage in his shunt.
Okay, nothing bad. No owies at all. Okay? Just shut your eyes. You don't have to do anything. Miss Pam will do everything, okay? Does your head hurt? No? Here?
Yeah.
Does it hurt a little bit right there?
Yeah.
How about back here? No? How's your IV? Is it all right? Huh? I asked him if it hurt here, and then I asked if it hurts here. And then if he'd said yes, I would have said here, and does it hurt here? And if I'd gotten yes to all of those questions, well then I can't really trust that this is right. But I asked, does it hurt here? And he said, yes. And then I pointed back here, and does it hurt back there? No. So he's a frontal headache. I don't want to take care of an adult, thank you. My husband will tell you that I don't take care of adults well. I have no patience with an adult because I've seen 5-year-olds. I've seen 3-year-olds. I've seen 5-year-old who's had an appendectomy. Wants to go to the playroom, babe. Yahoo! Let's go! A 35, 40-year-old who's had an appendectomy, I about have to light a bomb under him to get him out of bed because it hurts. Well, big frickin' deal. Yeah, it hurts. Get up. I'll come up with any game I can to get a kid to do what they need to do so that they think they're playing. I can play, and I can be a nurse all at the same time. And that's wonderful.
Christina Burkhart was born with a liver defect. Now 1 year old, she has come to Johns Hopkins because she's finally big enough to receive a piece of her father's liver.
Where's your daddy?
Since I was 15 and 9 months, I've always been an organ donor. I put that on my license. Just felt, you know, if I die, it'd be something neat to help somebody. I guess now it's even different because I'm still alive, and it's my daughter that I'm actually going to help.
That special tie.
She'll be 51% me. Give her a kiss for me, okay?
Liver transplants from a live donor are relatively new. Hopkins performs only about 5 a year.
I'll try to come and see you.
Okay.
Christina's mother, Paris, takes Christina to the OR about 3 hours after her father's surgery began. 1/4 of Robert's liver is all she needs to do the job of producing bile and cleaning her blood. Without a transplant, Christina would probably not make it to her 3rd birthday. But there's still a 15% chance that Robert's liver won't work for Christina. Robert's operation is almost done. The piece of his liver is ready to come out.
And you want to know, are you ready for the liver? How far away? How far are you?
I'll send somebody down to get it.
Okay. You want to send somebody to get the liver?
It will have to be passed quickly to a doctor who's prepared a sterile bath. The liver can stay in this icy solution for up to 24 hours. But the sooner they get it into Christina, the better. Once the liver arrives in Christina's OR, the doctors have to inspect the major vessels carefully. There's still a chance they could discover that it's unsuitable. Robert is closed up. His liver will regenerate in about 3 months. For a liver transplant on a baby, the intestines are removed from the abdominal cavity to give the surgeons room to work. Then, everything is tucked back in. The surgery went smoothly for both father and daughter.
My daughter.
Your daughter. What's her name?
Christina Paris.
Now, only time will tell if the transplant will give Christina a new chance for life.
She's doing good. She got her eyes open, you know. Yeah, she looked at me, she waved her hand and stuff at me. She's doing good, Grandma.
In the PICU, Charlie Wheeler has 2 patients who are in a lot of pain. Janae Hawkins was struck by a hit-and-run driver. She has 2 broken ribs and possible neck injuries.
There you go. All right, big guy, just hooking up your IV.
Lance Fallon has muscular dystrophy and has had a rod put in his spine.
More or less, they just kind of straightened out his spine is what they did. And actually, like, just wanted to see what the x-ray looked like. That's his chest x-ray, and that's the rods that they put in him to help straighten out his spine. So that goes all the way from his chest all the way down his back. And like in the PICU, you're dealing with the same families and the same kids day in, day out for 12-hour shifts. And I mean, you get to know the families really well. Don't let the tubes intimidate you.
When she go in and out, is that she's tired, or is that what the medication does?
Both. Probably a combination of lack of sleep plus the pain med that we're being given her is just knocking her out. It's really not as bad as you think. If you look up at the monitor, I'll tell you what all those are, and I'll just like convince you a little more here, okay? The top number, all right, that's her heart rate, okay? And a normal adult person is between 60 and 100. So she's right on where she should be. Blood pressures are usually for a female 100 plus your age.
So right now her blood pressure is 119 over 80.
Over 55. Actually, that's an awesome blood pressure for anybody. I'd kill for that blood pressure.
I can tell he has a military background. He's tough, but he's good. I mean, he's funny, and he's really good for Lance because he teases him. Lance loves that kind of bantering type thing.
Before you get a drink, because I know you want that drink, how about you give me 10 good ones, all right? At least get the like 90% of it is just being good, good communicator, being able to talk with the parents, being able to talk with the kids. You definitely need to have a good understanding of like child psychology, understanding where they should be at, where they're at now, and that kind of determines how you deal with them. Like, you know, some of the kids you get up here just screaming little brats, and it's just like, oh my God, you know, God, I wish I had some sedation right about now for this kid.
I mean, you know, when you think nurse, you always, I don't know why we think female, but there's a lot of male nurses nowadays too, you know. But he's doing a real good job. I like him, yeah.
Give me one more. Deep. Janae. When I was in the military, I used to be a medic, and I've always loved medicine. There you go.
Charlie was planning to become a doctor. Then, 7 years ago, he had an experience that changed his life.
My son was born at 42 weeks, so I mean, everything had been going great, perfectly normal. And on the third day, he arrested.
His son had a rare heart condition, for which at that time there was no cure.
And he had something called hypoplastic left ventricle. We had saw several specialists, so we had actually opted to have him disconnected from life support. You know, that's part of the reason I ended up here. Lance, how's your pain? That's a fine line that I learned between the doctors and the nurses. The nurses were always there for us. Well, I think that increased.
After his son died, Charlie decided to become a nurse.
When I was in there with my son and stuff, and the way they took care of him, you know, is the exact same way that I take care of my patients.
Nurse Irma Zerb is with 1-year-old Christina Burkhart, who's in the PICU after her liver transplant.
I know that would probably calm her too.
Absolutely.
Christina's mother, Paris, stands by in these first hours when complications are most likely.
She's losing from the surgical side. It's just normal.
She's holding her own?
Yeah, her vital signs are nice and stable. Blood pressure, heart rate. You know, she has a Gore-Tex graft over her now. Have you seen that before?
No, I have not.
Do you want to, or?
Oh, yeah, I can handle it. I just don't know if you can show me or not.
Sure, absolutely. She's your baby, so. Okay. And this is her graft. It has the drainage to her duval drain. And then she, of course, has her Foley in.
Yeah, oh, she's really puffed up, isn't she?
Yes.
And this wrist thing, what's that?
Okay, now, while they're intubated, we keep them restrained.
Oh, okay.
And she's already started to move because the first instinct will be that she'll try to
pull that out. Okay.
And even though she's small, she's capable of doing it.
Oh, sure.
Right.
I understand.
And then there'll be somebody in here all the time, like always.
So she's going to be pretty much out of it. Can I leave her blanket?
Absolutely.
She likes to have the
edges,
the yarn part near
then
her
let's
face.
Put it over here.
Or in her hand,
on this side.
You started all impersonal and objective and stuff, but then, you know, the more times that you get in to take care of the kid and the family, the more that you get to know them, the more that they get to know you, and they have, you know, enough trust in you. Just escalates like that with some of the families.
Definitely picture her grabbing at these tubes with no problem.
And when you start to get to know the families a little like that, and on a first name basis, then, you know, it gets a little more personal, and you're like, hey, you know, what are you doing today, or whatever. Or, you know, some families like might bring you up something to eat, no matter how many times you tell them no, and then they come up with a sub the next time that you're working. You know, it's like, what are you doing? He's like, hey, you're taking care of my kid today, you're doing an awesome job, here you go.
Pediatric nurses can have a profound impact on a child's and a family's future.
Especially because he's probably going to lose the rest of his arm.
Caitlin Hamilton has been taking care of burn victim Isaiah Moore. Isaiah has been sedated for much of the 8 days since he was electrocuted. He isn't fully aware that he has lost part of his arm and may lose the rest.
You know, sitting down from day one and saying, this is what happened, this is what's happening, this is what's gonna happen.
Yeah, Aaron, because we kind of
Caitlin thinks it's time to talk to Isaiah about what's happened to him.
To talk about this more, not talk about it, but he knew that something was going on. He just didn't want to look at it. And so I think it's time that, you know, we just sit down and tell him what's going on.
Caitlin has arranged for a specialist from Hopkins Child Life Department to come talk with Isaiah. He doesn't even remember his accident.
What happened when you got out the pool?
I caught a fever.
Caught a fever?
You caught a fever? And is that the last thing you remembered before you woke up here in the hospital? Yeah? Do you know why you're here in the hospital? I know you said that you caught a fever, but has anybody talked to you about why you're here?
Remember I told you when you put your fingers in a plug and you get electrocuted? Well, you grabbed the wire that was hanging in the alley, and that's what made you get electrocuted. But it wasn't your fault.
Absolutely not. And that wire shouldn't have been there. That's a grown-up thing to take care of, and your mom's right. It's not your fault that this happened and that you're here in the hospital. And all these scary things about, you know, am I going to lose other parts of my body? Because no one's talked to him about that and what everything means. And those are very scary things to be 9 years old and to know that you used to play football and do all these things that you love to do and be able to write. And how is he going to do his homework? You know, that's what was going through his head. You know, he feels pain in his fingers that aren't there. And so he knows that something's wrong and that, you know, but it's just a matter of sitting down and really talking to him and telling him. So that's probably the biggest thing today, is just psychosocial with him. Huh. For instance, like playing the tic-tac-toe, he asked his mom to do it because he said he couldn't do it with his left hand.
That's good.
Even though he has been using it to scratch his belly or to do different things, but not consciously aware that he was doing it. And once I said, no, you can use your left hand, go ahead and do it, he was able to make that X.
Excellent. You gonna go first? Go right for that middle one. That would be my choice too.
Isaiah will continue to learn to cope with the sudden new direction his life has taken. The adolescent floor. Teenagers.
Feeling okay?
Kim Pfeiffer, just 25, can relate to this age group.
Okay. I'm not that much older than some of these patients, and I think they know that. They know that most of the nurses up here are not that much older than them, and they can kind of see a friend in us.
How about 5'4.5"? You're pushing 5'5", right? 5'5" with shoes.
Okay. Go ahead, you can give that to him. Why don't you give that to him?
Kim's patients range from a boy with a brain tumor to another with asthma.
That you can use the telephone until midnight, and you know that no one can call in after 10, right? Your phone doesn't ring after 10. Only you are allowed in your bed. Got it?
But they're all teenagers with different concerns than adults.
Ready? You know, things like we've had patients who have had to leave the hospital so they can go to a concert with their friends or go to get out in time for their prom or get out in time for senior week, and try to make accommodations for those things so that they don't miss the things that mean being a normal teenager. Quantina has a 6-month-old.
Quantina Tisdale has sickle cell anemia, an incurable blood disorder. The disease causes deformed red blood cells that block her small blood vessels.
So just grab tape. I just ripped it open at the bottom. Just grab tape and...
The resulting pain can only be managed with a hospital stay and intravenous pain medication.
You haven't been in 2 months? When was the last time you were in?
March.
That's good.
Kim has known Quantina since she first started here as a nurse.
Are you working?
Going to start college to study computers.
Good. Lots of money in that. Sure you don't want to become a nurse? No. Okay, I tried to recruit one. It didn't work.
I don't like the sight of blood.
After all of that, she
I don't
doesn't
like
the sight of
needles.
blood.
I don't like needles at all.
She wants to take a shower. And in order to take a shower, she's going to come off of her IV fluids for a little while. With teenagers, it's one of those things we do to help keep a little bit of normalcy. So they can take showers and kind of do their home routine. So, of course, it's now 2:30, and according to the unit rules, she should have been up by 11 o'clock, but teenagers are late risers, so, yeah. All right, you're going to get up and get going?
All right.
All right. Thank you, dear.
Children can be uncooperative patients, whether teenagers or toddlers. Down on the infant unit is Anaya Ray with her mother, Aura. Anaya doesn't like having a tube in her nose, so she simply pulls it out.
She pulled a thing out her nose. Yep, she pulled it out. Girl.
Anaya is dangerously underweight for her 2 years, and doctors are trying to determine the cause.
Saying, oh good, I don't have to change your NG tube today.
The feeding tube is the first step, giving her extra calories straight into her stomach to see if she can gain weight.
Hi, my name is Pam. I have to stick a tube in your nose. Lovely introduction, isn't it, sweetheart? I'm sorry. I know. Swallow. Good girl. The biggest thing is that you let them know, you're hurting them, and you're trying to do it as gently as possible, and that you don't lie to them, and then you just get it over with. Too tiny, baby. Oh, that was lovely. Okay. You forgive me? Just get it over with, and then doing something with them that lets them know that it's over, number one, and that number two, they can laugh, they can smile, it's okay. All done? Go tell Mommy all about it. I wish you'd wipe the tears off your eyes before we take you back to Mommy, huh?
On the adolescent unit of Johns Hopkins, 14-year-old Andrew Vento is in pain from his surgery to correct a depression of his sternum.
How's your pain?
It's up there.
It's up there? Like 0 to 10?
8.
Yeah? Now, it's an 8 now. I went down on his pain medicine while you were gone.
Kim Pfeiffer needs to assess the effects of his pain medication. If it's not enough to let him relax, his recovery will actually take longer.
Whether or not your pain is under control.
But if he's too heavily medicated, he can't do the things he needs to do to recover quickly.
You're gonna have
like
some
get out of bed.
This machine is not gonna be like the magic take away all the pain. You've had your chest cut open. You're gonna have discomfort. But is that discomfort manageable, or is it out of control right now?
Oh, it's manageable.
Okay.
You know, when their parents are in the room, they might say that their pain is a 10 out of 10. The parent walks out of the room, and it's only a 5.
Not to say that I don't believe you, because I do believe you're uncomfortable.
Frequent contact with patients gives nurses an ideal perspective to judge where their patients are on the pain scale.
Come forward towards me.
The right medication is a delicate balance,
too.
requiring constant adjustment.
You get yourself standing first.
Usually, especially dealing with surgical patients, it's the first time out of bed is the worst. And to tell them that this is going to hurt. This is a reality. You are not going to be free of pain 100% of the time. That's not something that we can do. But getting them prepared for that so that they can mentally prepare and say, okay, this is going to be uncomfortable, but I can get through this. That's something that we help them do.
Oh, he was right.
What?
Today's the worst day.
See?
See? And
You did it by
tomorrow, I'm
yourself.
telling you.
You did it by yourself.
I think we'll take care of you again tomorrow, because then we can see your progress.
Okay.
Deal? Okay. Tomorrow you'll be walking up
See you
this way.
tomorrow, Andrew.
Okay?
All right, see you later.
Bye.
Back on the infant floor, the battle of wills between Pam and Anaya continues.
Because Mom told me you just put it
Yes,
back in.
I just put it in. Just, not 45 minutes ago. Just.
Anaya has pulled her feeding tube out again.
No, here. Yeah, that's what I'm saying. I can't get anything like, I take a steri strip
Oh, no.
and put it
that's
over,
not gonna
but
work.
she's all snotty, so it won't stick, so I can't get it down there. Oh my God, I'm just gonna be doing this like every other hour. Okay, so like.
Pam thinks she has the answer.
Here, put your no-nos on so you can get used to this lovely piece of equipment, first and foremost.
Oh, no.
I know.
We gotta protect our tube.
This just doesn't allow her to bend her elbows. And if you can't bend your elbows, you can't get to your nose. And if you can't get to your nose, hopefully you can't pull your tube out. No, she's not.
You really?
She has these things on, and these keep her from bending at the elbows. That's all they're supposed to do. They're not supposed to be tight, but if she can't bend her elbows, she can't get her hand to her nose.
Okay.
Upstairs with the teenagers, Kim is having her own battle with another patient who doesn't like tubes.
So tell me what happened last night.
I don't know.
15-year-old cystic fibrosis patient Heather Jones is determined to get off her
You know what
IV.
this is about? This is about you don't want to be hooked up to the pump. I know that's what it is.
No, it isn't.
But it's gotta go. Well, I think we should just let it burn through your vein then. That's what's gonna happen. You're difficult. There's a control issue. Now they're at the point where most adolescents are getting more and more independence. They come into the hospital and all of that gets taken away from them because it's a different environment and they can't control the things that are going on. It's for your own good. We don't want to burn through your vein. They make them that way for a reason. The rules are that way for a reason. Got it?
We don't want anything to happen to that IV
You make my life so difficult, Heather.
2-year-old Anaya has proven to be a worthy opponent for 20-year veteran Pam Butler.
Because she took her tube out again. Yeah, she laid down in her bed and rubbed her face in her pillow until she pulled it out.
So they finally compromised on something that works well for her. They're just going to feed her at night. So that way she'll get what she needs and be happy. Right?
Oh, that IV doesn't look any good.
Like most kids with cystic fibrosis, a congenital respiratory and digestive disease, Heather has spent her entire life in and out of the hospital.
You always do.
I do it at the same time. Yeah, that's your Parmesan. You do your Sarah.
She has a complex daily treatment schedule of antibiotics, enzymes, and inhalants, and endures up to 4 hours a day of being pounded on the back to break up mucus in her lungs.
No, that's okay.
You are so difficult. Stubborn.
Stubborn. She is stubborn.
Kim wants Heather to get a port, a semi-permanent valve in the skin that would save her veins from the damage wrought by frequent intravenous antibiotics.
It's the Heather in you.
For some teenagers, like cancer patient Morgan Garrison, the port is a welcome innovation.
It comes through here, goes all the way up and all the way up to there. And then it just goes at me. And the thing about the port is it's wonderful because you get one stick and it's done. All week. So it's wonderful. It's a lot better than IVs, I'll tell you that.
But for CF patients, whose life expectancy is barely 30 years, sometimes just looking normal is the highest priority.
Heather, I think if you met someone who had one in their arm, you would definitely see
I
them.
have.
Who?
One of the girls over here has one. She's got a PIC line. She's talking about.
Not a PIC line.
I don't want a port either.
But a port in your arm?
I ain't getting nothing else.
But you won't be able to see it. And then it won't even be near your heart, so you won't have to worry about that.
Yeah, but I don't want anything that looks funny. And you're not gonna be able to tell.
You
yes,
look
you
funny,
will when
so-
when I wear tank tops and stuff. That's all I wear.
You won't be able to tell, and actually that's why that patient had it put there. The one that I had who had it in her arm, she had it put in her arm because then she didn't want anyone to be able to see it, especially during the summer. Because when you're wearing a bathing suit, you can see the one in your chest. Heather, eventually you will see things my way. Yes. I'll be retired. But
Without a
you'll see things
port,
my way.
it won't be long before her veins are so damaged that an IV will be impossible.
It takes too much time.
I don't know why, but a lot of the kids that get cystic fibrosis, they're about some of the most stubborn kids you'll ever meet. Because they've been in and out of the hospital so many times, they know the routine.
I mean, if I do it at home, I would
Cystic fibrosis patients have badly scarred lungs and suffer frequent infections. There's no way to know if their next infection will be their last. In his first weeks as a nurse, Charlie Wheeler was taking care of another CF patient, Jen Dagger. It was a particularly difficult time for Charlie to begin his nursing career.
The PICU was pretty much tapped overall. We had several critical patients that had come in this month, and out of them, we had 13 deaths in 1 month, which is a very large number, especially for Johns Hopkins. And pretty much all the nurses were feeling the effects, and it was just...
It just one right after the other.
In the midst of this crisis, 15-year-old Jen Dagger was admitted. She was having trouble breathing, the symptom of a routine CF flare-up. She and Charlie quickly became close friends.
Things took a turn for the worse, and she just decompensated really fast, and then she passed away. And we were supposed to, that was the big thing, is when she got out of the hospital and she was well, we were supposed to be going to Six Flags together because she rides all the cool rides. So, I mean, we were gonna go to Six Flags, and her family and my family just, no, you know. No.
Charlie is facing a fundamental occupational hazard for nurses: grief.
And I think that there is that fine line. There is a line between being a nurse and being too close. I actually did have a patient that I became very attached to, and it affected me to the point where I almost left nursing altogether. And I think that's how you, in a way, for some people, and for myself, that's how I learned.
Should have been a cop, but you know, that's beside the point.
Now, the question is, can we fill it in, I guess?
In Christina Burkhardt's room, a crisis is unfolding the day after her liver transplant.
That's okay, but mainly what we would like to do is talk to you. We've been getting some conflicting stories out here.
From?
Dr. Mallory, I guess, told this mom that they were looking for another liver.
Christina's grandmothers have heard a rumor that Christina has been placed back on the national list of people waiting for a liver donor. But no one seems to know yet exactly what the situation is.
Could it be fairly large, a large area? Because it looks big, but
She's not rejecting her new liver, but her latest sonogram is indicating possible problems.
I mean, this is so big here.
Christina's mother is anxious to find out what's happening.
I'll come right back and talk to you, okay? Don't go away.
But for now, all she can do is wait. At the bedside, the nurse is the hub around which revolve all the players in a patient's care. The doctors, family, social workers, technicians, they all come in and out. But the nurse is there and has a role in every success, every crisis.
Depending on the results, they can tell that it's...
Irma Zerb tries to explain to Pari Burkhardt why Christina's latest tests have doctors
They're
worried.
getting the results. I guess they're going to confer on the ultrasound and see, you know, if everything's perfusing the way they expect her to, and whether she's clotting enough to hold on and give it a little bit more time.
Come on, Christina.
And sometimes, you know, it does take a while for the liver to do what it needs to do.
Before long, everyone's worst fears are confirmed. Pari gives the news to her mother that the liver isn't working.
They're gonna try and get Chris up here.
Have they got on a list then too? Okay. Oh, when did they
It's
take
just not
it?
kicking in. It's just not working. It's not turning on.
So that's what Dr. Lau
She's
said?
not rejecting it. The liver itself is not working.
Oh.
Like it's supposed to.
Did they just get the results of the sono now?
She's got another clot in her portal vein too. So he's gonna go ahead and take her back in and try and help this liver work. But for some reason the liver itself isn't kicking in.
Oh, for heaven's sakes. Oh.
So the Beckards are calling Chris and they said get him up here as quick as you can.
Do you want to go over and talk to your husband?
Yeah, I think I should tell him he needs to know.
Yeah.
I've got the chair.
Oh, she's beautiful. Hey, honey. I love you. Get one, you'll find one. I love you. I love you, baby.
If the doctors can't make this liver work, Christina's condition will be even more critical than before the transplant. There won't be much time to find another donor and try again.
It's a very hard thing, and you can't always not get involved. I think that sometimes you, in a way, you have to get involved. But you have to be able to pull yourself back and say, I'm not part of this family. She's not there.
You do everything you can to make sure that you can give whatever you can give, but it doesn't always work. The rule is that it's not fair and that patients die. So you have to accept that, not like it. Accept it. Make it part of you. That's all you can do.
Your face, and the whole world is on your case. I would offer you a warm embrace to make you feel my love. Evening shadows and the sky.
I sing because it's me, number one, just who I am. But number two, it's a wonderful tool. Number one, it's a distraction tool. And especially if it's a particularly silly song, I can get away with all of a sudden listening to your breath sounds. It's also a good assessment tool. You can see if they hear and how well they hear. The other reason I sing is to soothe and protect and make a child feel comforted.
Go to the ends of this earth for you.
Where are you going?
Make you
Taking care of somebody terribly sick is easier if I also have somebody down the hall who has asthma, who I know is going to go home and is going to be fine. And that balance keeps your perspective that I see a small section of society that are very sick.
Yes, you are. I gotta go fix your roommate. He's having a fit. He is having a fit.
Christina's new liver was badly damaged by a blood clot and failed to work.
We just don't understand it, you know. But they're not gods, they're doctors, right? So it'll work out. There will be a happy ending to this story.
With only about 24 hours to find another liver, doctors began testing her uncle as a possible donor. A 12-hour process. It was a match. Now Christina will face her second liver transplant in 2 days. But there's no guarantee that her uncle's liver will work any better.
Good job, Andrew. Making mom work too.
Some days I come here and I feel like you do your job and it's uneventful. There's days that I get in my car and I laugh, and there's days I get in my car and I cry.
Good job, Andrew.
With this one experience that I had right after this patient passed away, 2 nights later I came back to work and I had another patient with CF. And as soon as I went into that room and had an interaction with her, I knew why I do this job.
When I walk in the room, when I'm in there, that's the part I love. I'm so lucky that in some way I get to make a difference, however small.
For sick children, small differences mean a lot. They can be the first steps down the difficult road to recovery.
You can rest. I'll push you.
Can you get back in?
Burn victim Isaiah Moore is in physical therapy now. After being in bed for almost 6 weeks, he must learn to walk again.
Do you got your...
And with his arm now amputated to the shoulder, he will have to relearn the simplest tasks.
Be right back.
When Isaiah first came in, Isaiah was a very shy child, didn't interact much, having some issues with pain in regards to his dressings, that type of thing. And past 5 days, new kid.
Hey, I'm actually I actually want to lock it.
And you see kids like Isaiah that come in shattered, but go out possibly in a wheelchair, but they're making steps. And they may just be baby steps initially. But you know that those steps and those strides are going to get longer and they're going to get stronger. And it'll be because you made the choice to make a difference.
Ooh, that's going to be a hard one.
Isaiah isn't the only child who's made a dramatic recovery recently.
Now, have you seen Christina yet? No? You need to go take a look at her because her eyes aren't yellow anymore. They're just as white as can be. So we know the liver is working. So it's just a joy and it's a miracle, you know, because we went through a rough time. It's a miracle.
You excited? You like all the noise, huh?
You guys have any questions for me?
Christina will be going home soon, a success story. She will take anti-rejection drugs for the rest of her life, but her liver defect is cured and she is essentially healthy.
Give it up, honey.
It's a welcome turn of events for everyone in the PICU, especially for Charlie.
I'm doing okay, so I look forward to coming to work almost all the time.
Yeah, have you guys ever listened?
It's weird because you don't really try and get over involved, I'd call it, with the patients and the families, and that was one thing that I had a problem with, obviously. I wouldn't say I've gotten better at it, but at least I know how to control it somewhat a little more now. I want to be able to hear you in the other room.
Okay.
Crying is actually a good thing because it'll help her move up
Clear it up,
secretions
cough it
and
up,
stuff.
yeah.
So.
Okay.
All right.
Yep, we'll go to town.
Like my dear old dad said, you take the good with the bad, the glad with the sad, and the happy with the crappy.
And there's many of them a year down the road. I don't even know. The only way I know it's them, they look so good, is because I see their parents. And I look at them, and then I look back at the kid, and I go, oh my God, that's him, or that's her. And they go, oh yeah, this is the look. Look at what happened after we went home. It was so good.
There's some days that I go home and I feel like, wow, I cannot believe I did that today. That was a wonderful experience and I would love to do that again. And that's why I do this, because I love being challenged. And working with this population is definitely a challenge. I think it's a big deal.